ready? You got me running.
I am Meredith Hirsh, and this is Working Healthcare. Today, I interviewed Neeraj Puro. He is the Director of Health Administration Programs at Florida Atlantic University, where I teach. And we all think that AI is great, but Neeraj actually has a different perspective, which we get into. We talk about everything from academia and expectations of those who teach and of the students we teach. He is originally from India, and we talk about the Indian healthcare system compared to the American healthcare system. And we also talk about how he is making healthcare administration and the teaching of healthcare administration different in the university today. I was really excited to meet with Neeraj outside of the classroom setting, and I really hope you enjoy today's interview. Neeraj Puro, welcome to Working Healthcare.
Thank you so much. It's a pleasure.
I am so excited to have you. You and I met, about a year ago. No, probably only in April, when it was for the American College of Healthcare Executives team meeting or team competition.
Case study competition.
Exactly.
Yes.
And I was giving the kids a really hard time. And so afterwards you came up to me and said, "Oh, I see you teach at FAU. Maybe you want to be a part of our program."
I know.
So you are actually the director of the health administration programs at Florida Atlantic University, both undergrad and graduate levels. Describe what you do.
That's a good question. And it's a broad question. So my day-to-day activities mostly involve, first of all, I'm a researcher first. So something related to research. So start of the day starts with what is going on in different healthcare journals. The first thing that I do. Then it's all about day-to-day activities, which is managing students, managing the faculty, then having the faculty scheduled for all of their classes for the next semester or upcoming semesters, and then setting up ACHE events for the students, or setting up, say, so there is a student body club at FAU called Future of Healthcare Executives.
Mm-hmm.
So once in a week or once in a month, we have our alumni who want to engage with their students. So I try to set up some of those alumni engagement meets as well for the students.
And you're originally from Mumbai, and that's where you did a lot of your programming actually in clinical pharmacy. And then am I right here?
That is correct. So I did my undergraduate in pharmacy, and then I did 2 years. I tried my hand as a clinical pharmacist.
What brought you to the US?
So before that, I'll tell you why I switched my careers from clinical pharmacy to health administration. One thing is, after being with patients for too long, I realized about my personality that I am kind of an introvert person. So talking to patients for like 8 hours, 10 hours took a lot out of me. And then getting my internship in a government hospital in India, I figured from a resource perspective, organizations always strive for resources. And that's where my fascination started for health administration.
So in India, they're struggling for resources on the administration side just as much as we are in America.
Absolutely. I think it's the case everywhere, Meredith, especially when it comes to the government hospitals in India. So it's a problem. And that's where I did a master's in health administration, where I figured that, so I had 2 internships back in India, one in a non-profit setting and one in a for-profit setting. In a non-profit setting, for the first time, I did something called as a costing of an ICU. And there I knew how difficult it is to run a hospital or any healthcare organization. And that's where my liking for healthcare finance came into place.
Right, because you actually teach in the finance program, which we've talked about sometimes with the students, and we're going to talk about that down the road in this podcast, the challenges and the differences when we were in school versus some of the students that are in class right now. And you really love the finance side, but then you went to the University of Alabama and got your PhD.
Yes, so I applied for 4 programs in PhD. I got admission from two. One was in upstate New York. I'm like, I'm not going from Bombay to upstate New
No.
York. Yeah. I don't want seasonal depression. That's where UAB was a perfect place for me, Birmingham, Alabama. It was an affordable place. And second thing is, I came into the number one MHA program into the country to do my PhD. So I think everything fell into place for me.
Why did you decide to go the PhD route and not just stay in healthcare administration?
That's a good question, Meredith. So I worked for 2 years for one of the biggest hospitals back in India, in Bombay. And for some reason, I thought that my liking is towards academics more as compared to working in a corporate setting. I enjoyed working in a corporate setting, so I was kind of a clinical manager over there, but I did not enjoy physicians calling me at 12 a.m. at night to figure out the operations part of things. So I was like, let's go to academics and let's try to give back knowledge to the students. And academic part always fascinated me more than the industry part.
Okay, so you always knew that you wanted to, not always, but at that point you said, I want to stay on the academic side. Talk me through your transition to FAU. What did you do after Alabama? How did you actually get into this role overseeing all of the healthcare administration side at Florida Atlantic University?
So it's a long journey, Meredith. So I'll keep it short. So I finished my dissertation from University of Alabama in mergers and acquisitions in healthcare, which I know you're passionate about when it comes to private equity and mergers and acquisitions. And luckily, there was an opening for assistant professor in Florida Atlantic University. So I applied for the job and I got that job. And from 2019 to 2025. So it took me 5 years to get tenured at Florida Atlantic University.
Is that fast to get tenured?
No, 5 years is an ideal time to get tenured.
Okay.
But the requirements of FAU for getting tenured are quite high. And FAU recently got an R1 status, which is the Research 1 university now. So that's pretty amazing. So the research requirements are pretty stringent. But I managed through the research requirements. There was COVID time as well during that. So it was tough on everybody. So recently, 2025, I got promoted to associate professor, which is called a tenured associate professor. And there was an opening for the director position of the health administration programs. And the chair of my department asked me to apply for it, and I got the job.
Okay. But we've talked about the fact that a lot of people in the teaching sector are not people who were doers. They went the track and just went from academia to academia to academia, or school, and then they started teaching. And that's where you and I really connected, because you had the background as a clinical pharmacist. You had worked in the healthcare world. I work in the healthcare world. That's one of the reasons why I teach, right? You want teachers who have done, not teachers who just talk about doing it. What have you found in the university setting? Are those that you oversee people who actually are like me and do this for fun? You know, I call it my hobby. Or are these people who are solely committed to academia and they don't work in healthcare?
So I can tell you two things. One is we have a traditional MHA program and we have an executive MHA program. So in the traditional MHA program, you will find faculty who are pure academic side. But in the executive program, you will find faculty who are mostly adjuncts and who have a working full-time job. So that helps a lot for students to network with all the people who are currently working in, say, nursing homes or hospitals or hospices and all of these industries. So I think it's a perfect setting for executive students to interact with the faculty when it comes to the professionals working in the healthcare field.
Which is great, but don't you think that would be great for the traditional track too?
So that's where the student clubs come into existence, where so I personally feel when you are an undergraduate student or a graduate student in a traditional program, it is up to the students to motivate themselves and interact with the people around in the community. That's how I see that. That's why I'm proud to say that the Student Body Club have started this FHE, and that has led to many significant networking opportunities for the current students. And some of the students have even landed jobs, especially one of my students is working with you now in the Hirsh Center. So I'm proud of that.
It's always really, and I actually didn't know that, so we'll have to talk about that. But I think that's great. I remember when I was one of the judges at the competition for the ACHE program, I could tell the students who had worked in healthcare and those who hadn't, because some of the ones were so off the mark because they actually didn't experience a lot of the challenges firsthand. And so their decisions or their ideas or their solutions for what's broken or what's not working or how to generate more revenue weren't actually viable options. But I saw those who had the experience doing it. So when somebody gets their master's in healthcare administration from FAU, are they required to do any types of internships or externships or work in the healthcare sector?
Yes. So the internship aspect is inbuilt in the curriculum. So they have to do around 220 hours of the internship. Now, 220 hours technically is not a lot of hours for the student to interact with the mentor in that particular organization. But I think that is sufficient time for a student to understand the basics of how to run a healthcare system. So if you have 6 or 7 departments in an organization, and if you can do the rotation of those 6 and 7 departments, say for example, billing, or say for example, admissions or discharges or whatever it is, I think that is a good opportunity for the students to learn what is the patient journey from entry to the discharge point. And according to me, that is the most essential part. Another thing I want to highlight is finding a good mentor in that particular organization. If you find a good mentor in that organization, the mentor can actually give you a good project to work on. Like you said, like ROI. Find the ROI if you want to invest in, say, an emergency department. That's where having a good mentor helps the students for the networking and to figure out what to do in the career going ahead. I tell my students, like, the whole point of internships, you are supposed to know what you don't want to do.
I love that. It's funny that you say that because gosh, sometimes I still don't know what I really don't like to do. I try to say, or I try to involve myself in so many different arenas because I actually do like to do a lot of different things. I'm always like, but what do I really need to do? Or what is my skill set? And I think that's great. What do you not want to do? Because it's really tough for people like me who are hiring fresh grads or those who have maybe dabbled in certain areas but haven't had enough time, and they come in and they job shift all of the time because they're like, nah, don't like that, nah, don't like that, nah, don't like that. And you're like, oh my God, what do you like?
Yeah. Just to give you an example, Meredith, to your point, I think you can always tell from the students whether they are introverts or extroverts, right? So if an extroverted person goes and works in a nursing home, they may not have the best of the experiences. But if they go and work in a consulting company if they get a chance and work there, they thrive on the chaos of working in the consulting company, talking to people. For example, I am an introvert. If I talk to too many people a day, I get tired, Meredith. But some of my students are extroverts through and through. So they'll thrive on chaos. They love to speak to people. They love to network. And that's what I tell them. Like, try to figure out your personality, what you want to do, and then we can figure out a sector for you. Because healthcare is big. You can find opportunities everywhere. And I'm going to tell you, Meredith, yesterday I attended a CEO roundtable conference. Hospitals are popping up everywhere.
Everywhere. Krista was at that lunch, that breakfast, I guess it was a breakfast CEO down in Broward County. And I wanted to go and I had a conflict and couldn't. But she said it was amazing. And it was just a great opportunity to hear that those in the hospital sector are struggling just the same way we are in the private practice or independent practice sector. And so we have a lot of similarities. You left India. You've lived in the US for 10 years. When you left 10 years ago, did you ever expect to stay here permanently? Was that your goal?
Not really, but I started loving the United States as a country because of the diversity it provided. And second thing, I personally feel US is the best country to live if you want to become an academician. The resources that any university can provide, you can't get anywhere in any other country. The databases, all the resources, the networking opportunities, the innovations, all of these things that happen in US, there are hardly any countries that have seen this kind of innovation as compared to US.
I love that you say that because people are like, why are you dissing on the American healthcare system? Why are you criticizing it all of the time? I'm like, listen, I think we have the best healthcare system in the world, but it's still fractured. It's still broken. And there are things that we can do to fix it. I don't think we need to scrap it. I think that we need to make some changes and make it even better. But I'm in that like Six Sigma rule where you can always improve, right? You can work at the upper echelons, but I don't really think we're there
I
yet
have
in
a
healthcare.
favorite quote on that, Meredith. So my quote is, every healthcare system across the globe sucks. US healthcare system sucks the least. I can
There
tell
you
you
go.
that.
I'm going to use that. That's what I'm doing. So tell me what it's like in India. Because I was just at a conference. I was at the Rheumatology Private Practice Association conference, and I swear half my colleagues, and I call them my colleagues, they're really rheumatologists, they're doctors. I'm not. So my favorite saying is, I'm not a doctor, I just sleep with one. But I shouldn't say that. But I mean, we've been married almost 30 years. I feel like I can say it at this point, and we have 3 children, but that's enough. So a lot of Indians, like a lot of people who are from India, now they're American, so American Indian in the correct version, right? In the correct way you say it. And they never had any intention of going back to India after they went to medical school in the US. So what is the US healthcare system, or how is it different? How does it suck less than the Indian healthcare system?
So I'll tell you, Indian healthcare system more or less is exactly like United States, but the out-of-pocket spending is much more in India. So India is a less insurance-based healthcare system as compared to United States. Otherwise, when it comes to the setup of government hospitals, non-profit hospitals, for-profit hospitals, you can find everything back in India. The only concept that is different is the insurance-based system. But with the new generation, I think the insurances and the health insurance concepts is popping up. But when I graduated, 80 to 90% people were still paying out of pocket. And out of pocket can be a huge burden for a country like India where the poverty levels are quite high. So I'm telling you the parallels. On an average, every single year in United States, around 400 to 500,000 people file for bankruptcy related to healthcare costs. So it's relatively similar numbers back in India as well, where the healthcare cost can put you into bankruptcy.
Okay, that's interesting to know. It appears like it's a 2-tiered system then.
It is.
You're either going to the government system where I would assume that you have to wait and wait and wait, right? Because the resources are very sparse.
That is exactly right. So all the government hospitals treat patients free of cost, but the waiting line, like, it is a chaos, and that's a problem. But if you want a top tier system, you have all the hospitals in India to get the top tier system as well.
You just have to pay for it.
You just have to pay
Pay
a
to
lot
play.
for it.
Yeah. And so looking at, I'll talk about Bernie Sanders, maybe he needs to go to India to see if that's what he wants. He keeps saying we need to have a Canadian system. And I've actually had people who are Canadian on working healthcare and talked about that system. And they're like, no, you don't want the Canadian system either.
Yeah, I'm not sure about the Canadian system as well, because if you have to wait for 4 to 5 weeks or even like 10 weeks to see a PCP, Even like specialty, you have to wait for 20 weeks to get an appointment. Yeah, I'm not sure if it's the best system as well.
Right, exactly. So let's talk about those people who are going into healthcare administration. So, who are you seeing as the undergrad students who decide, hey, this is the path I'm taking, and this is why I'm taking that path?
So, interestingly, Meredith, I have seen recently that children who have parents in healthcare, either a nurse or a physician, they have their children doing major in healthcare administration. That's a recent trend I have noticed, and it's an interesting trend. I understand healthcare, like majoring in healthcare may not be a priority, especially in Florida, because the private equity in money in Florida for, say, marketing or international business, that is more fascinating as compared to healthcare administration. And I understand that, but this is the recent trend where students with, say, an uncle or an aunt or somewhere who motivates them to go into healthcare, those students are doing major in healthcare administration.
So, why are they not going to nursing school, or why are those students not becoming doctors? Why are they going the administration route?
So from the couple of students I have spoken to, they try to do the shadowing for nurses or, say, nurse anesthetists during their high school years, and they didn't enjoy the patient interaction or they didn't enjoy the needles and all of those things. That's why they're like, let's go in a noble field, which is healthcare, but let's stick to the administration aspect of things.
Do you find that these students are equipped to handle all that healthcare administration encompasses? So we're talking about the financial side. That's where I feel the skill set lacks the most. So we could talk about the financial side. We could talk about the operational side. The rules and regulations are changing every single day. It's like whack-a-mole. So how does the university prepare students to enter healthcare? And then do you feel like you have the ability to set them up for success?
That's a tough one, Meredith, because as an educational institute, we have only 31 to 33 credit hours for the students to finish their MHA program, for example, which may not be a lot. And in those 31 to 33 credit hours, they take different courses, right? A course in law, a course in strategy, a course in organizational behavior, a course in finance. But the practical experience that they need, it's difficult to provide that in the classrooms every time. Yes, we can give them examples. Examples are provided throughout the theoretical framework. But the theory and the practice, what you do, it's like a day and night difference between the two. I know, as I've told, right, I did study costing, right, of something. But when I actually did costing of an ICU, it took me 3 to 4 months to figure out the activity-based costing. Like every second, there are costs to running an ICU, how to do that. So it took me 3 months to complete just one project.
I agree with you. I took accounting at the undergraduate level. My minor was business. And I dropped it the first time because I was getting a C. And I had a really tough time, and I was really trying. And I graduated with high honors. So for me to get a C, it was not a common thing. And I took it again and ate my C, whatever. I got a C in accounting. And then I went back in the master's when I was getting my MBA, and I got a B plus. I'll take it. But it was so much easier. It made sense because I had worked in QuickBooks for several years. We already had the Hirsh Center. I was already overseeing the entire financial structure and working with my accountant. So I had the aha moment of like, yeah, now I really understand debits and credits. So I didn't understand that originally. Do you think that an internship program is needed for students who are at the undergraduate level, or those who are going the traditional path and not in the executive MHA program?
So we have an internship aspect for 6 credit hours built within the undergraduate program as well. So if they want, they can do two different kinds of internships in two different kinds of settings.
Is it mandatory?
It is mandatory.
Oh,
It's a
good.
part of a curriculum. And it's built in such a way that our students have landed jobs in those after, because internships comes at the end when they're about to graduate. So if they graduate and the organization wants to hire the students, they can just hire the students straight away out of school. So we have built the program in such a way that the students get some kind of experience in the healthcare organization.
How do practices or organizations get involved in becoming an internship site for students?
So we have an internship coordinator. They reach out to the community leaders. They reach out to our alumni. So I can tell you from my personal experience, reaching out to alumni has been a blessing, because the alumni wants to give back to the community where they graduated from, so they can go at any lengths to create some kind of internship opportunities for the students. And if they can be the mentors for the current students, that's a win-win situation for everyone.
I'm not even thinking about giving back. I'm thinking almost in an egocentric way, because it is so difficult to find those professionals who can do the administrative side, can think outside of the box, can problem solve. And so you actually get to see what students are capable of. You can teach students skills. You can teach any employee skills. It's hiring somebody, though, who is smart and kind. I always say kind, but smart and kind, somebody who can get it and actually take the knowledge that they have to learn the skills.
That's a good point, Meredith. One thing I struggle, one of the classes which I personally struggle is a law class, because I feel healthcare is one of the most regulated industries, and you can't teach everything in three credit hours for a law. So if you want to run a nursing home, or if you want to run, say, a Hirsh center, you need to be aware of all the laws and regulations, and there are thousands and thousands of those.
Or you hire people. Like, I have a compliance consultant. We have an employment lawyer who's on retainer, and we pay him a set amount every month, and he's available for us to ask questions, because at some point you actually have to reach out to others. You can't know everything.
That is true.
But you're right. And not only are there so many regulations in healthcare, and I've always said, I think right after finance, or we're on par with finance, we are the most regulated industry.
I think we are the most regulated industry.
Yeah, it's a little insane, but it's regulated in the wrong way, but that's for a different episode. But maybe we should regulate PBMs a little bit more. But there is a lot to learn. Do you see that students graduating now have the same abilities or the same strengths or expectations as those even 10 years ago? Do you see a shift going on? Because I'm trying to wrap my head around it, and I don't know if it's called pre-COVID versus post-COVID, or if it is generational, or our expectations have changed, or social media has changed our expectations. But I feel like those going into their first job, or even in the early part of their career, are not always my strongest players.
So, Meredith, there are two things that every academician is struggling with right now. One is the attention span of the students. I have seen that going down significantly post-COVID, because I taught a class pre-COVID and I'm teaching classes post-COVID as well. And second thing is the adoption of AI. It's a big thing. Like, students use ChatGPT most of the times for everything. I am not against that, but there has been recent reports of high use of AI negatively correlated with, say, for example, the retention. If you are using ChatGPT for writing essays or everything, like the retention of whatever you have read, like, what is it? It's a problem. Like, what are you getting out of it? Because before ChatGPT, we expected students to go and read the research papers and then summarize it. But right now, AI is doing it for you. So what are you getting out of it?
Well, that's exactly what my mom said years ago. I remember driving up in the middle of Maine. We were visiting my kids for camp weekend, and my mom's a social worker, and she and I love to analyze the differences in the generations and even the time
Mhm.
periods and why people are different the way that they used to be. I say it's anthropology. I don't know, whatever you want to call it. But we're talking about problem solving. Why can't people problem solve the
Mhm.
way that they used to? And my mom and I came up with this theory that when I was younger, I had to use the Dewey Decimal System. I had to look up articles on microfiche. I had to go spend an entire
Mhm.
weekend in the library and dig into the information to find it. Now, somebody can just go online or go on to ChatGPT, as you said. And so they haven't had to work at that level
Mhm.
and utilize the brain power to build the skills to be able to do it. So the problem solving skills stink, honestly.
They do, and it's a problem. And another issue, Meredith, is about the AI itself. The AI hallucinates sometime, so it throws up insignificant results, and students are not even sure if those results are true or false. And that is a big, big problem. Second thing for me is about AI is whatever humans up till now have created the knowledge, AI is trained based on that particular knowledge. But if there is something called as a sloppification of AI, where you produce nonsense out of AI, right?
Hmm.
So it's called AI slop. So if the next AI models are trained based on the current AI slop, it's a
Mm.
big, big issue. And if students use that to write essays going ahead, it's going to be a big challenge for all the academicians to say, go back to pen and pencil and paper and come back to the classes.
Well, I think that would be great sometimes, let me tell you. I mean, people will tell me something statistically, and I'm like, let's just sit back and think. Does that make sense? Like, how does that make sense? Like, let's use our problem solving skills because most of the time it doesn't. And I struggle because now I'm teaching online,
Mhm.
and you know that. And I either have the option to teach, what was it? Now, what is it? Synchronous teaching, right?
Mhm.
Where you can be in person, but people can also see you live uh, virtually, or I have to be 100% virtual. The reason why I decided to be 100% virtual is because if I teach
Mhm.
in person, I'm given like a 6-foot area that I can walk back and forth in
Right.
between because of the video, because I need to make sure that my online students are, if we set them up in
Mhm.
groups, doing or able to do the project while my students in class. And honestly, I feel like either a magician or a magician who's juggling, it's a little difficult. So I'm like, let's just put everybody online. But I don't like it. I don't feel engaged. And isn't the point of a business program or healthcare administration program an opportunity to connect and build your network?
I am with you on this, and that is the recent trend I have seen with all the students who just prefer online classes. The whole point of college is to come, discuss, socialize,
Hmm.
be with other students you are uncomfortable with, be with students in the group projects you don't like, because you are not going to find people at work who are you are going to like forever. So that's the whole point of group projects, that's the whole point of being in person. So call me an old school, Meredith, but I am with you on this. I want more people to be in person so that when they project, when they have group projects, when they present, they have to know what they are talking about. With online classes, it's becoming difficult. And another problem is the rampant cheating with online classes on ChatGPT.
Hmm.
I'm going to tell you, every academician is struggling with it, including me. And there are no easy answers right now.
Like, why be in school if you're going to cheat your way through it? That I don't understand. And on the flip side, I also am struggling hiring people because they don't want to come in person. I don't know what to do. I literally am in the process of bringing on virtual assistants from other countries hired through an American company because those are the regulations, but I can't find enough people in America or in our area that want to actually drive into work every day.
That is the actual problem I am facing with the internships. Even for internships, students want them online. Not even hybrid, Meredith. They want it online. The whole point of internship is to go out and talk to people and understand how the system works. That's the whole point. And you're missing the point by doing some things online. So
And I don't even feel like I'm that old, but you're probably 10 years younger than me. And so we are still, listen, you're a millennial. I'm a Gen Xer. And we have these Zoomers looking at us going, ugh, but people did that back in your time. Like, it's with the wagons and the horses. So it's like, no. This is how we build connections. When you are a physician taking care of a patient, you don't do that virtually. Even if you're in psychiatry, I would think that having that human interaction and being able to visually see the expressions, even be able to feed off of each other's, right? I'm a big energy person. It is vital to success. So how do you, in your role now at FAU, overseeing this program, are you going to make a change? Are you going to make a difference? Are you going to mandate that students be in person?
So that is going to be a challenge right now because we recently, our traditional programs recently transitioned from evening classes to daytime classes. In the evening classes, we used to find all working students who used to come for the classes. And that was an amazing opportunity for all the students to talk to each other. And most of them were working. So they knew what they were talking about. But with the current students, they are amazing, but they are a little bit inexperienced. So I'm facing that issues right now. But I am trying and I'm pushing all my faculty to bring in as many guest speakers as possible for students to interact with the guest speakers. I think networking is the single most essential thing, especially in healthcare community. Healthcare community is small. I have seen how proactive ACHE South Florida is. They have events every month. And for student members, they have to pay $30 or $40. Like it's pretty inexpensive. Just go to all the ACHE events and meet people. So that is my point right now, to push all the students to go for whatever events that are happening in healthcare and just talk to healthcare leaders if you get an opportunity.
Are we lowering our standards?
A little bit. So I just saw a report yesterday that came from Harvard University where 55 to 60% of the students who are getting an A as compared to 20 to 25, 15 to 20 years back.
That's pretty insane. It's that's what I've said, but my son, I'm going to use him as the example, my youngest son who's 19, he will tell you that it's actually become more difficult and they're even brighter and they're working even harder than we ever did when we were in school. And it is more difficult to get into school. And I don't know, any good data that I can counter him with?
I'm not sure about that, Meredith.
So what do you want a 22-year-old, like future administrator, to understand about the relationship of our healthcare community, of hospitals, about community practices, about the physician or nurse or clinician experience? What are you looking for?
So I'm looking for them to understand that United Healthcare System is one of the most fragmented healthcare systems. There are too many moving parts in the system. So all you have to do is look at the big picture and try to connect the dots. And I have seen that with our alumni who work in, say, accountable care organizations or value-based care, of how they are trying to connect the dots with the providers, with the insurance companies. That's what I want the current students to understand, that healthcare system is like $4 or $5 trillion industry right now, but it is not one size fit all system for
$5 trillion. And literally in like 2 years, we're up to about 7 trillion. And it is just growing exponentially at this point. But really, when you look at it, it's not those who are in healthcare administration, unless you're the CEO
Mhm.
of an insurance company or a PBM. Who's getting all of the money? Where do you direct students for opportunities where they're like, hey, I want to make sure that I have a financially stable future?
That's a good question. So recently, I have been pushing my students to look at nursing home administrative jobs. So there is a 2000 credit, 2000 hour paid internship in nursing home to get a nursing home certificate, like an administrative
Mhm.
certificate. So once you finish your, say, bachelor's, right, you can get those 2000 hours under your belt. So you're eligible to become a nursing home administrator. And I feel nursing home industry, it's relatively easy to break in for a young graduate as compared to a hospital industry, which is a chaos machine. Hospital, it's a like big system. It's difficult for a young student to navigate that particular system. Instead of a nursing home, where if you can find a good mentor, it's relatively less complex as compared to a hospital, and you can learn faster.
What about private practice? What about independent medicine? I feel like that's what's
Mhm.
missing within the administrative side of the healthcare classes that are taught at the university. And you and I have talked about that.
Mhm.
You've talked to me about bringing on a private practice type
Right.
curriculum, and it certainly isn't in place right now. And when I've been involved at Florida Atlantic University specifically, all of the professors are part of ACHE, the
Mhm.
American College of Healthcare Executives. It's very hospital based. MGMA, the Medical Group Management Association, I find is much more on the smaller practice side, or not that we don't have hospitals in MGMA either, but they're more private practice, independent
Mhm.
practice in a smaller sector. And that's what's missing. And so when people are graduating from these programs, they're thinking hospital. They're thinking, in your example, nursing home. They're not thinking, oh, I could have great opportunities at the Hirsh Center. So what do independent practices do to attract this type of talent?
That's a good point, Meredith. And when we build the MHA curriculum itself, part of us are guilty of that, to not expose students to these kind of independent settings. There's another reason is the curriculum itself. If you look at any textbooks, most of the examples in the textbooks are based on hospitals.
Mhm.
And that's a problem, because things become glossy for students. They think after they graduate, they can start working in a big hospital. After 5 years, they can become a CEO. But the things doesn't work out that way, unfortunately. So we are guilty of that, because the examples itself that we provide to the students are mostly related to the hospital. So they are not even exposed to small systems or even like mid-tier systems. Now, Hearst system, I want students to come here at the Hearst Center and do a costing study maybe, or do a study based on efficiency. If you want to improve, say, patient efficiency, or look at just the insurance part of the things. How many patients coming in your center are, say, Medicare patients, Medicaid patients? What is the costing behind every patient? How does that work? This is the kind of projects I want my students to do, and I am pushing for it, Meredith.
You're pushing for it and you have such enthusiasm to do it. But you and I have been talking since April, and there's still nothing on the books because, and now we're in, the end of the year. But that's because if you want to talk about the restrictions and the red tape, and the bureaucracy, let's talk about the academic world, right? How long does it take to actually create change within curriculum on the university level?
So, if I have to introduce one new course, I have to go through 5 channels of permission, and that can take 6 to 8 months just to introduce one course. Here I'm thinking about changing the whole curriculum right now. So it's
So you'll be doing it until you retire?
no, but the current chair of my management department and the dean have been quite supportive. So I'm hoping all the changes will start in fall 2026.
I hope that the changes happen before independent medicine is no longer a viable option, because that's really my fear. There's so much going on and so much changing. And as I said earlier, we are playing whack-a-mole, trying to oversee all of these regulations, trying to really understand what our role is. It's funny, this morning when I was at a meeting with Krista on my team, she and I looked at each other and I said, well, is this a task you're going to take on or I'm going to take on? She said, honestly, I don't even know really what my job is anymore. She goes, I just do it. So that's how we feel, right? There's so much going on. Yeah. We're a bit in craziness. With everything that you've seen on the academic side, with your 10 years now in the US, if you could create, and I'm going to wrap this up because I wrap up every podcast in this way. If you could create one change within our American healthcare, and I'm going to pivot and say education system, because you are an educator. Within our American healthcare education system, what would that change be?
I feel whatever classes we teach in MHA program I'm specific about, they should blend into one another. Right now, the classes don't blend into one another. I'll give you an example. If we teach quality of care course, that class should blend into the operations course next semester with one example of how you can improve the quality of care through the operational efficiency or Lean and Six Sigma. Finance course, right? If I'm teaching finance course, it should blend into the strategy course. If you have to open an emergency department, it's a part of strategy, but you have to have knowledge of the financial part. What is the ROI going to be? So I personally feel if we change that part across all the MHA curriculums of blending one class into another, I think we can be much more successful.
I am so grateful for your time. Neeraj Puro, thank you for joining me on Working Healthcare.
Thank you for having me, Meredith. It's a pleasure.
If this conversation hit home or made you think a little differently, don't keep it to yourself. Share the episode, tag a friend, or post about it on social media. Connect with me on LinkedIn to keep the conversation going in between episodes. If you've got a question, an episode idea, or someone you think I should feature, send me a note at meredithhirsh.com. Thank you all for the 5-star reviews. They help more listeners find the show. New episodes drop every Tuesday. Subscribe so you don't miss what's next. Tune in weekly as we explore the inner workings of healthcare, because you can't fix what you don't understand.